under the sponsorship of the Joseph Mulak Eye Center. Now, the leading ophthalmologist who specializes in cataract surgery, who's leading the symposium, is here with us today to talk about it, Dr. Mary Kay Michelis. Welcome to Channel 22. In this symposium now, first of all, the public is invited. It's free of charge.
This is free of charge, and the public is invited. I think those individuals that will enjoy it the most are the individuals that are probably over the age of 40 that have medical diseases involving the eye.
Now, in addition to cataract, and I'm going to ask you to explain exactly what that is in just a moment, you're also going to talk about other subjects affecting the eye, too, as well.
This symposium that we have on a quarterly basis, and we deal always in talking about cataracts, glaucoma, diabetes, things like the dry eye and how it affects the elderly population. We also update any new changes that are occurring in ophthalmology, new instrumentation, new types of surgical procedures, in general, just bringing things up to date for the individual, the lay public.
Now, the Friday night session, is that a repeat of the Thursday night session as well as the Saturday one is a repeat? So each one is the same session?
Each one is the same session,
so they don't have to go all 3 times in order to get the thrust of your whole
just one evening
symposium.
or one day.
So you have your chance then of going Thursday night 7 to 9, Friday night 7 to 9, or on Saturday afternoon 1 to 3. Now, it's going to be held at the Pacific Hospital at Long Beach in the auditorium.
Right, in the auditorium.
Okay, now there are, I suppose, many millions of people that are affected with this, cataract being your specialty. Would you explain to us exactly what is a cataract and what are the kinds of cataracts that you're going to be talking about treating there?
Well, George, I have a little model here. It shows just slightly there on the television, but this is a model of an eye.
Okay.
And in talking about cataracts, we're talking about an opacity of the lens of the eye.
Now, this being the lens.
Now, let me take this apart for you and give you a little anatomy lesson. This is the clear window of the eye called the cornea. Sitting right behind that is the colored part of the eye, which is called the iris. Now, right behind that is the natural lens of the eye. And when the natural lens of the eye becomes opaque, it is called a cataract.
It clouds up.
It clouds up. So when a cataract is removed, the natural lens of the eye, by one or many surgical procedures, actually is removed. Now, when you remove the natural lens of the eye, it's like taking a magnification lens away from the eye. So unless you place magnification back on the eye or in the eye, you don't have the ability to focus. Now, there are one of 3 methods in order to be able to see again after a cataract has been removed. One are cataract glasses. These are the slightly heavy glasses that we wear in the front of the eye. The disadvantages to those are that it magnifies images by about 30%, and it limits the peripheral field that you have. The second method we have are what's called contact lenses. Now, contact lenses fit on the front of the eye. For the majority of the ones that are used today, they're put in and taken off every day, although we do have new contact lenses that can be worn for more than a month at a time, but not every individual can wear that type of contact lens. And the third method is what we call an intra-ocular lens, which is a tiny piece of plastic, this is just a model, that is placed in the eye in the general area where the cataract was removed.
So it's a manufactured plastic lens with little bands on it that hooks right into the eye there.
That's right. And
how do you get it in there now?
Well, it's
you open up the eye.
You open up the eye, and it's surgically implanted at the same time that the cataract is removed.
Is that fixed then?
It is fixed in some way, either by a stitch or by a clip or by some method where it's the tissues of the eye attach itself to that lens.
How reliable is that? And say long-term, has that been working
Well, as far as we know, reliability is long-term. The first lens was placed in the eye in 1949 in England, and the longest lens it's been in eyes right now is about 22 years. We have the majority of ophthalmologists in the United States at this time are trained in this procedure.
Now, in the use of this, do you also have to wear contacts or glasses along with this?
Not usually. About 40% of the people that have an intraocular lens don't have to wear glasses. But if you're talking about fine-tuning your vision in back to 2020, most people will wear just a simple pair of bifocal glasses over their eye after they've had their cataract operation.
Now, what kind of cataracts are we talking about that this particular kind of operation is effective on?
Well, this is effective on any operation, and in fact, everything from the kinds of cataracts where a child is born with cataracts, we are using intraocular lenses in some children that have had cataracts removed. On the way up...
Even though the eyeball may get a little larger? Or
even though the eyeball may get a little larger. And the main reason is in children that are born with cataracts before the age of 7, it's important for them to have visual stimulation so that they don't develop what we call a lazy eye or amblyopia. And we're finding that many people, many children, do better with an intraocular lens than they've done in the past with a contact lens, as far as visual rehabilitation is concerned.
Are there other new scientific techniques that have been developed, say, in other areas, such as diabetes and the eye, or glaucoma, the other that you were talking about?
Well, certainly in diabetes in the eye, we're involved heavily in the treatment when it's indicated with the use of laser. Laser is light beam, and in some diabetics, there's the blood vessels get like little bumps on them, and they tend to bleed, and so many times we can treat this with a laser beam. As far as glaucoma is concerned, we're using laser again in the use of glaucoma. Instead of having to do certain surgical operations, they're actually being done with the laser beam, and a type of glaucoma that's called angle closure glaucoma, in order to make a small hole in the colored part of the eye or the iris of the eye. Laser is used to do that.
How do you get over the fear factor? I know the people that I've talked to have had this kind of surgery, very fearful they're going to lose all their sight. Maybe they just want to do one eye at a time, so that if something doesn't quite go right or something, they still have the one eye. I suppose the element of fear is one that has to be overcome.
I think one of the most frightening things to most individuals is the loss of vision. I think only cancer really is the other thing that we're so fearful of. It's true that with any surgical procedure there's a possibility of complication, but our success rate with modern medicine today in the surgical procedures that we use so far outweighs the risk when you're talking about the possibility of getting better vision. And I think each individual, of course, is different in deciding when that time comes to have surgery, and only in discussion with their own physician can they decide what the risk factor is. But the chance of visual rehabilitation, when you're talking about removing a cataract and being able to see again, to function, in the 20th century, we're such an active population.
The idea of waiting for it to get ripe, so to speak, that seemed to be old talk, terminology, that you couldn't operate, and you kept getting older and older and older until you're too old almost to have the operation. What about that now?
That's certainly not necessary with the surgical techniques that we have today. It was a necessary thing when you go back many, many years because of the way a cataract was removed. But as far as today, with the new procedures, things called phacoemulsification, which is where we use sound waves to break up a cataract to remove it through a small incision, techniques like that, it's actually better to remove a cataract before it gets, quote, ripe. And the term ripe means that it becomes totally white. And usually when that happens, there are also other changes that have occurred in the tissue that holds the cataract, so you may even have more complications if you wait that long.
There will be question and answer period following all of the seminars, that's true.
Yes.
And then you will also have on the lectern with you your colleagues there. You might mention their names.
Right. Dr. Oliver Neese will be speaking on glaucoma. Dr. J. Winthrop Macy will also be talking about cataracts. And Dr. Anna Mae Crowder is going to be talking about diabetes. Okay, that's Pacific Hospital of Long Beach. They're located on 2776 Pacific Avenue. The number to call for more information, you see it there, 595-5441, extension 223 for the big symposium on eye treatment. That's this Thursday, Friday, and again on Saturday. We want to thank Dr. Mary Kay Michelis for visiting with us today and telling us about it. Thank you, Doctor. Thank you, George.
And back to more stock market programming.